हाय अर्चना।
हेलो।
आवाज आ रही है?
हाँ हाँ, आवाज आ रही है।
नमस्ते
नमस्ते
मैम।
मैम। नमस्ते। ऑडिबल? यस
यस
मैम।
मैम।
हाउ आर यू? गुड मैम।
गुड मैम।
सर इज जॉइनिंग, जस्ट 1 minute।
नमस्ते सर।
नमस्ते सर। अच्छा
या
मेरे ऑडियो तो है।
तो everybody is joining. Yeah. So welcome to all. Good evening, ma'am and sir.
गुड
Uh,
इवनिंग।
Myself Sangeeta Singh from Bhopal and Dr. Archana from Dehradun. We both welcome our guest speaker, Dr. Rajkumar sir and Dr. Ramya Krishnan ma'am. Dr. Rajkumar sir, Associate Professor and HOD of Rog Nidan Department, and in Mahi, Puducherry. Dr. Ramya Krishnan ma'am, Associate Professor and HOD of Dravya Guna Department, Mahi, Puducherry. We both welcome you as a guest speaker in today's episode of How to Learn to Understand Ayurveda, Komaribhit exclusive. So,
थैंक यू।
in last, thank you, ma'am. In last two episodes, episode 8 and episode 9 was done on Sri and Prasuti. It was in two episodes actually. 8 episode was Sri exclusive and episode 9 was Prasuti exclusive. And this episode is going to be Komaribhit exclusive, right? So ma'am, before starting to today's episode, actually, um, we and Archana, I would like to ask Archana about the flaws in curriculum, in existing curriculum. What is the flaws is there in our existing curriculum? So, Archana, actually, in today's, when I was in third year also, एंड नाउ ऑल्सो मैं जब भी करिकुलम को देखती हूँ कमारे भित के करिकुलम को तो मुझे लाइक फुल ऑफ फ्लॉज ही नजर आते हैं. सो व्हाट इज योर पॉइंट ऑन दैट?
जैसे कि फ्लॉज में क्या कुछ एक्सप्लेन करके बता सकते हो?
या सो देर आर फ्यू पॉइंट्स लाइक फॉर एग्जाम्पल अगर मैं कहूँ कि देर इज अ पॉइंट लाइक इम्पोर्टेंस ऑफ काश्यप संहिता इन कौमारभृत और नवजात शिशु परिचर्या, नवजात शिशु परीक्षण, नवजात शिशु पोषण, ऑल दोज थिंग्स जो हम पढ़ते हैं दैट इज लाइक वी आर जस्ट थ्योरेटिकली लर्निंग ऑल दोज थिंग्स. जैसे एक अगर हम मैं एक छोटा सा एग्जांपल लेके बताऊं कि साइंटिफिक कंट्रीब्यूशन ऑफ काश्यप संहिता इन कौमारभृत, तो भी मैं ये कहूंगी कि 40 to 50 पॉइंट्स हमें उसमें बताए जाते हैं, बट एक्चुअल में मॉडर्न इरा में उसका साइंटिफिक कंट्रीब्यूशन क्या है वो हमें नहीं पता है. लाइक वी आर जस्ट लाइक 5 मार्क्स का हमने उसे लिखा थ्योरेटिकली और फिर जो है कि जाने दिया. तो लाइक दैट इज हाउ वी आर लर्निंग इन आवर करिकुलम और थर्ड ईयर में हम उसे ऐसे पढ़ रहे हैं. तो द वर्ड इफ वी आर गिविंग साइंटिफिक कॉन्ट्रीब्यूशन, तो उसे मॉडर्न एज के इरा में समझाना भी तो उतना ही जरूरी है, पढ़ाना भी और प्रैक्टिस भी करना. आई एम नॉट फाइंडिंग दिस एंड दिस मेक्स मी लुक्स लाइक कि कितने सारे फ्लॉज हैं हमारे करिकुलम में.
हाँ, आई अग्री टू दैट, लेकिन ये सारे जो टॉपिक है ना हमारे अकॉर्डिंग इट इज नेसेसरी, है ना? क्योंकि कौमार नृत्य एक एज अ सब्जेक्ट हमारे सिलेबस में है, तो हमें उसके बेसिक प्रिंसिपल्स के बारे में नॉलेज तो होनी ही चाहिए। कई सारे टॉपिक्स ऐसे हैं जो नहीं होने चाहिए, लेकिन फिर चरक संहिता जैसे है उसमें कई सारे टॉपिक्स हैं जो कि अभी प्रैक्टिकल जिनका इम्प्लीमेंटेशन नहीं है, तो फिर उनको रिमूव नहीं कर सकते ना हम। और फिर अभी हमारे पास ओपीडी में पेशेंट्स भी नहीं है, और सारे सीरियस पेशेंट्स जितने होते हैं हम उन्हें रेफर करते हैं, इवन एक्यूट इन्फेक्शन हम उन्हें रेफर कर रहे हैं, है ना? और केवल लेखन अध्याय है जिसका प्रैक्टिकल इम्प्लीमेंटेशन अभी के टाइम पे हो रहा है हमारी बाल रोग की ओपीडी में। तो हम सिर्फ लेहन अध्याय को नहीं रख सकते ना सिलेबस में, अगर उसका प्रैक्टिकल इम्प्लीमेंटेशन हो रहा है। और फिर बाल चिकित्सा जो है वो संहिताओं में भी प्रॉपरली मेंशन नहीं हुई है, और काश्यप संहिता भी पार्शियली अवेलेबल है। तो फिर ऐसे कॉम्प्रिहेंसिव नॉलेज कौमार नृत्य की तो हमें है नहीं, तो इसलिए हमें लगता है जो अभी करिकुलम है वो सही है।
ओके। सो जैसे कि अर्चना आपने कहा कि काश्यप संहिता भी पार्शली अवेलेबल है और कौमारभृत की लिमिटेड नॉलेज है, राइट? तो लाइक बहुत सारे आपने पॉइंट्स बोले, मैं एक एक पॉइंट पर आऊंगी। पहले पॉइंट पे जैसे आपने बोला कि इनकम्प्लीट नॉलेज है, तो उसमें अष्टांग संग्रह में एक श्लोक आया है कि तदेव दोषस्य दुषस्य ज्वराध्य व्याधस्य यत् अतस्य तदेव भैषज्य मात्रा तू अस्य कनियसी। सो दोष भी वही है, दुष्य भी वही है, ज्वर आदि व्याधि भी वही है, केवल मात्रा का डिफरेंस है बच्चों में। सो अगर अगर हम इस पॉइंट को ही कंसीडर करें तो आचार्य उस समय ही बोल रहे हैं कि हाँ, जो भी काय चिकित्सा में मैंने अभी तक बता दिया है वही सारी बच्चों में भी चीजें होंगी, बस मात्रा का डिफरेंस होगा। तो हम ये तो नहीं कह सकते हैं कि हाँ लिमिटेड नॉलेज है। फिर आपने कहा कि पेशेंट नहीं है, तो बहुत सारी चीजें चरक में भी होती है, पर हम जो है कि उसे पढ़ते तो हैं ही। तो दैट डजंट मीन कि हमें हमारे भी हमें नहीं पढ़ना चाहिए अगर उसकी प्रैक्टिकल यूटिलिटी दिख नहीं रही है। द पॉइंट इज घूम फिर के उसी पे आ जा रहा है कि अगर प्रैक्टिकली यूटिलिटी नहीं है, दैट मीन्स कि हमें साइंटिफिकली पढ़ाया ही नहीं जा रहा है, इसीलिए हमें प्रैक्टिकली यूटिलिटी भी नहीं दिख रही है और ना ही हम उसे प्रैक्टिकली इम्प्लीमेंट भी कर पा रहे हैं। आपने कहा कि जैसे लेहन अध्याय ही लेहन चल रहा है, स्वर्ण प्राशन चल रहा है, तो हमें क्या लेहन ही पढ़ना चाहिए? तो अब मेरा क्वेश्चन ये है कि स्वर्ण प्राशन पे आपका क्या स्टैंड है? क्या जो स्वर्ण प्राशन चीजें हो रही है, प्रिवलेंट है अभी टुडेज की इरा में, क्या वो सही तरीके से हो रहा है स्वर्ण प्राशन?
आई थिंक
Sangeeta,
स्वर्ण प्राशन जो है, यस मैम।
yeah, the question was to me, right?
नो मैम, आई वाज आस्किंग टू अर्चना।
Okay, okay. Actually, it was partially audible to me, so not
ओके।
clear. Last part, yeah. Please proceed.
या।
तो हमारे अकॉर्डिंग जो स्वर्ण प्राशन हो रहा है वो सही ही है, क्योंकि फर्स्टली तो वो आयुर्वेद के पहले प्रयोजन को पूरा कर रहा है जो कि है स्वस्थ से स्वास्थ्य रक्षण। तो ये हम प्रिवेंटिव मेजर की तरह लेके चल रहे हैं कि जब हम वो बेबी को स्वस्थ रखेंगे तो उसको नेक्स्ट स्टेप की जरूरत ही नहीं पड़ेगी, है ना? और फिर इसकी फलश्रुति भी बताई गई है शुश्र संहिता में कि कुमाराणाम वपुर मेधा बल बुद्धि विवर्धना, कि अगर मेध्य द्रव्यों से सिद्ध भित्त का लेहन कराया जाएगा तो उसकी बल बुद्धि में और आयु में वृद्धि होगी, है ना? और फिर इतने सारे रिसर्च पेपर पब्लिश हुए हैं पीयर रिव्यूड जर्नल्स में, जिनमें कंक्लूड किया गया है कि स्वर्ण प्राशन से फिजिकल और मेंटल हेल्थ इंप्रूव होती है बेबीज की। तो फिर उसे क्यों नहीं करना चाहिए? तो हमारे अकॉर्डिंग स्वर्ण प्राशन सही है।
तो द स्वर्ण प्राशन आपने जैसे कहा कि बहुत सारे रिसर्च आर्टिकल्स और पीयर रिव्यू जर्नल्स में पब्लिश है। तो पहली बात तो जो भी स्वर्ण प्राशन के लिए डिटेल्स मॉडर्न रिसर्च जो भी पब्लिश है जर्नल्स में, वो मॉडर्न रिसर्च के पर्सपेक्टिव से पब्लिश है। तो जो मॉडर्न रिसर्च से पब्लिश है तो हम उस पर रिलाई कैसे कर सकते हैं? आयुर्वेदा इज अ डिफरेंट साइंस एंड इट शुड बी पब्लिश। उसका रिसर्च भी आयुर्वेदा के प्रोटोकॉल पे होना चाहिए। जैसे स्वर्ण प्राशन है, लेहन है, उसका कॉन्ट्रा इंडिकेशन इंडिकेशन स्नेहन जैसा होता है। तो स्नेहन में जैसे कॉन्ट्रा इंडिकेशन में बोला गया है कि अग्निमांद्य है, ज्वर है, श्लेष्म वर्धक अवस्था है, फीवर और भी अगर बहुत सारे क्रॉनिक अलाइनमेंट्स हैं, आमज अवस्था है, तो हम वहां पे हमें नहीं देना चाहिए। लेकिन इररिस्पेक्टिव ऑफ ऑल एंड स्टेज ऑफ दिस थिंग्स, हर एक महीने स्वर्ण प्राशन पुष्यक्ष नक्षत्र में बच्चे को दिया जा रहा है। So according to me, it is completely wrong. According to not me, according to science, it is completely wrong. Ayurveda science, it is completely wrong. अगर भले ही हम जो है कि उसे कितना भी मॉडर्न रिसर्च पैरामीटर पे प्रूव कर दें, इट विल ऑलवेज गोइंग टू बी रॉन्ग अकॉर्डिंग टू आयुर्वेदा, अगर हम स्टेट एंड स्टेज ऑफ दी उस पे नहीं दे रहे हैं, और हम उसे मॉडर्न इम्यूनाइजेशन वैक्सीन के साथ हम स्वर्ण प्राशन दे रहे हैं. टू मी इट इज ऑल्सो कम्प्लीटली रॉन्ग.
मॉडर्न
मॉडर्न
मॉडर्न वैक्सीनेशन तो हमारे अकॉर्डिंग बिल्कुल सही है, बिकॉज पास्ट टाइम में बहुत सारे ऐसे एक्यूट इन्फेक्शन होते थे जिनसे बहुत सारे नंबर्स में बेबीज की डेथ हो रही थी, और उसके बाद मॉडर्न इम्यूनाइजेशन के काफी अच्छे यूजेस देखने को मिले हैं, लाइक सीरियस डिजीजेस को खत्म किया गया है और इन्फेक्शन के प्रिवेंशन को भी रोका गया है, और मोस्ट इम्पोर्टेंटली जो इन्फेक्शियस डिजीजेस थे लाइक मीजल एंड मम्स, उनको इरेडिकेट किया गया है कम्प्लीटली, एंड पोलियो एंड स्मॉल पॉक्स जैसे वायरस को और इन्फेक्शियस डिजीज को ऑलमोस्ट लाइक इरेडिकेशन के प्रोसेस में वो है. तो आई गेस मॉडर्न इम्यूनाइजेशन प्रोग्राम कम्प्लीटली सही है.
तो अर्चना, जैसे आपने कहा कि बहुत सारी डिजीजेस को इरेडिकेट किया गया है और सही है, बट द पॉइंट इज कि हर एक वैक्सीन का अपना बेनिफिट और रिस्क होता है. दैट मीन्स कि अगर वो बेनिफिट रिस्क के साथ आ रही है तो वो कम्प्लीटली इफेक्टिव है नहीं, 100% इट इज नॉट इफेक्टिव. दैट मीन्स कि उसके कोई ना कोई एडवर्स इफेक्ट है. दैट्स इटसेल्फ मीन्स कि दैट इज एन अशुद्ध चिकित्सा अकॉर्डिंग टू आयुर्वेदा, राइट. अगर वो एडवर्स इफेक्ट आ रहा है बॉडी पे, अगर एक साइंस का इनकम्प्लीटेंसी, अगर मॉडर्न साइंस जो है कि इन्फेक्शन को दूर नहीं कर पा रहा है, उसकी कमी की वजह से हम ये, उसके डोमिनेंस की वजह से हम ये नहीं कह सकते कि बाकी पैथियों को भी जो है कि इन्फेक्शन वगैरह ठीक वो नहीं कर सकते हैं, राइट. सो अकॉर्डिंग टू आयुर्वेदा, ऑल दोज थिंग्स अगर जो एडवर्स इफेक्ट लेके आ रहे हैं, रिस्क के साथ आ रहे हैं, ऑल आर अशुद्ध चिकित्सा. और हम देख रहे हैं कि एक्यूट कंडीशन, अगर जो भी इन्फेक्शन होती है, अगर हम उसे नेचुरली रिवर्स करें तो बच्चे की नेचुरल इम्यूनिटी बनती है. बट अभी हमने वैक्सीन करके अल्टर्ड इम्यूनिटी कर दी है, पैसिव इम्यूनिटी हो गई है बच्चे की. सो विच इज अगेन अ रॉन्ग थिंग, एंड नेचुरल इम्यूनिटी इज नॉट देयर. तो हमने एक्यूट इन्फेक्शन की जगह हमने क्या पाया, हमने ऑटिज्म पाया, एडीएचडी पाया, हमने ऑटो इम्यून कंडीशंस पाया, जुवेनाइल डायबिटीज पाया, एंड एक्सेट्रा एक्सेट्रा. So to me it is completely wrong practice. हमें आयुर्वेदा इम्यूनाइजेशन की जरूरत है, आयुर्वेदा रिवर्सिंग ऑफ एक्यूट कंडीशंस की जरूरत है, सो दैट की नेचुरल इम्यूनिटी बच्चे के अंदर है. Isn't?
Yeah, I agree with you on adverse effect part, और हमें इसका डेटा कलेक्शन करना ही चाहिए. So what do you think is the way forward?
Actually the thing is कि yes, कि साइंटिफिक हमारे करिकुलम को नहीं है. That's why we are here to how to learn to understand Ayurveda, so that कि हम उस साइंटिफिसिटी को जान पाए कि हमें पढ़ना कैसे है, उसे इम्प्लीमेंट कैसे करना है, और जो है कि ग्राउंड लेवल पे उसे कैसे इम्प्लीमेंट करना है. Structure has to be prepared for all those things. That's why we are doing here this episode. And am I audible?
Yeah.
Yeah. So that's why we are here for this episode. And again, I welcome Dr. Rajkumar sir and Dr. Ramakrishnan ma'am.
Thank you.
Yeah. So, sir, my first question is, one second. Vaccination and immunization according to modern is mandatory and practiced. What is your stand on Ayurveda immunization? Is only Swanprashan is the glory of immunization? Is vaccine and drug injury to immune system in kids is real? If yes, shouldn't it be taught in curriculum? Am I audible?
Yeah.
Yeah.
You're audible. So the thing is that, should I reply?
Yes, ma'am. Yes, ma'am.
Okay. So the purpose of Rasayana itself, as the science is telling, Labho Bayo Hi Shastanam Rasadinam Rasayana. So all the dhadus are getting advantage by rasayana. So dhadu get nourishment and optimum nourishment. From the optimum nourishment only ojas is being generated in the dhadus. So for getting shuddha ojas in dhadus, what is most needed is srota shuddhi, is it not? Because parinamam abadyamananam dhadunam abhivahini bhavanti ayana arthena. So srota shuddhi is a prerequisite for rasayana. Rasayana can be administered only when srota shuddhi is there. And srota shuddhi can be achieved only if the child is having any sort of ailment or susceptibility to any sort of ailment. Like if the child is having ojas, there are three forms of uh, ojas pathologies. Ojo visramsa is there, ojo vyabhat is there, and ojo kshaya is there. So it is ojo visramsa. Some children are prone to get ojo visramsa. Some children are already in ojo visramsa by mismanaged infection or in acute infection. Ojo visramsa stage can be there. Sometimes ojo vyabhat, altered immune state, bala vyabhat can be there, like allergy, autoimmune disease. Sometimes some children are having ojakshaya, immune deficiency conditions. So all of them, the same Suvarna Prashana. Suvarna Prashana is a general rasayana. Suvarna Prashanam Hyedat Medhagni Balavardhanam Ayushyam Mangalam Punyam Vrishyam Varnigrahapaham. So many properties are mentioned in Kashyapa Samhita. But the thing is that whether the child is having the srotas of the child and the dhadus of the child are in a state to receive the rasayana. That is the first question. So evaluation of child for rasayana, and second, what kind of rasayana the child is requiring, because there are different kinds of rasayana. Kamya rasayana is there, like to boost the normal growth and development. Kamya rasayana is advised. Vak kamya, medha kamya, ayu kamya, different types of kamya rasayanas. Then naimittika rasayanas are there after disease for fast recovery and stabilization. Dhadu sthiratva and ojas sthiratva. Naimittika rasayanas are advised. Then ajasra rasayanas are advised. Tanya is considered as ajasra rasayana, brahmana rasayana, that nourishment to the child. Jivanam brahmanam satmyam snehanam anushampayaha. So stanya is also a rasayana. So ajasra rasayanas are mentioned. Fourth most important, ajara rasayanas. When child is always eating chocolates, when the child is not listening to parents, doing all sort of viruddha ahara viharas, and even improper behavior, improper conduct, misconduct, their counseling is required. Counseling and rectifying the child's habits into positive ones. That is what is mentioned in Ajara Satyavadinam Akrodham Nivrittam Madhyamaidhunam. Addictions in the child, any sort of addictions, they are to be withdrawn. All these are also rasayana. It doesn't mean that rasayana means only Suvarna Prasha. Rasayana can be adopted in different ways. For example, in a healthy child, Madhura Snigdha Shidani Laghuni Cha Hidani Cha. Madhura Snigdha Shidani Laghuni Cha Hidani Cha Ojasam Vardhananyahu Tasmat Balam Tadashi. So this is also rasayana, Madhura Snigdha Shida Laghu Dravyas. So you can consider all these as rasayanas. Suvarna Prashana is expensive rasayana. And if Suvarna Prashana is being administered also, there are many prerequisites. Child srotas, dhadu, rasa shuddhi should be there first of all. Srota shuddhi should be there. Agni should be excellent. If the child is prone to get any diseases, that should be, or if the child is in the state of disease, it has to be reversed. All these aspects, and even what you called ojo vyabhat like conditions, those substances which are antagonistic to visha are also considered as rasayana. So that is also rasayana, like practice of viruddha viruddhatva, those dravyas which are viruddha, opposite to viruddhatva, those dravyas, visha shamana dravyas. Tikta rasa, so tikta rasa is medhya rasayana. There are kadu rasa rasayanas, tikta rasa rasayanas, madhura rasa rasayanas. So it is not like one rasayana universal antidote for all the ailments of child is wrong. So there should be a separate chapter, in my opinion, Ayurvedic immunology, basic principles of Ayurvedic immunology in children. Pediatric immunology, Ayurvedic principles of pediatric immunology should be there, where OJS is to be taught in detail and pathologies of OJS should be taught with regard to modern ailments. And how rasayanas are to be administered is to be taught with estimation of the child, estimation of the recipient for rasayana. That should be taught systematically. That's all.
I would like to add that health and disease are exactly opposite things. Like when you are having a disease, you cannot improve health. When you are having health, disease won't develop. So that is the principle which is adopted in Ayurveda. So we are resisting all diseases, or we are developing immunity against all diseases by improving health. It's not by one vaccine you are preventing smallpox, one vaccine you are preventing chickenpox. For diabetes, you are doing some other treatment. For pancreatitis to prevent, you are doing some other treatment. For heart ailments, you are doing some treatment. It's not like that. When health is there, when light is there, there is no darkness. The same way, when health is there, no disease. So immunity increasing is not by vaccination or passive immunity increasing. So passive immunity also has so many problems, like it is artificially making the adaptive immunity active. So when adaptive immunity is directly made active without making the innate immunity active, that can result in abnormal immunity development. And it will be very specific to that specific virus or whatever be the pathogen. Some difference in viral mutation, if happens, same infection they can develop, or with that vaccine itself, they can develop infection. So vaccine is not a solution, and it is not increasing your immunity. It is a temporary adjustment. It is only a temporary adjustment. So how to improve immunity is entirely different in Ayurveda. When Dhadunam Param Teja is Ojas. So when all the Tattvagnis are properly acting, that means he is having good resistance. So it is by improving health. Ojas increases when health is there. So first produce health, then increase the stability and acne of Dhatus, which is Ojas. So that is how we are improving immunity. So just as what Dr. Ramya told, we have to learn Ayurvedic immunology as a separate topic, and how this is different from modern system and how it's acting, means both in physiology as well as in specifically in such conditions. And finally, Rasayana is making the channels of rasa dhatu. So rasa dhatu aharaha starpedi varthedi tharedi yapedi. So in a child, how to do rasayana? It is not by giving rasayanas, medicines. It is by making the channels of rasa proper, or srota shuddhi is to be done. So breast milk is the best rasayana in the infant stage, or immediately after birth. The best rasayana is breast milk. So afterwards, how to improve rasa dhatu and how to improve absorption. That is the most important rasayana. Monthly once, if you are giving one rasayana, and it will not be acting on manas. Medha is a function of sadhaka vitta. Buddhi medha abhimanadne abhipredartha sadhanam sadhaka vitta. So it's just improving the activity of sadhaka vitta only. It is not acting on manas. For manas to improve manasic activities, you have to practice that. When you are practicing manasic, like knowledge gaining, Medha Varthana is done by Sadada Adhyayanam, Vada Paratantra Avaloganam, Tadvidya Acharya Sevacha, Buddhi Medha Garu Granaha. So this is how you are improving registration capacity, how you are learning, comprehending capacity, you are learning by improving manasic activity, not by giving one rasayana. You cannot improve your Medha Shakti. And Rasayana yogas are indicated Purve Vayasi Madhyeva in young age. It is indicated. So what all Rasayanas or Medhya Rasayanas, something what is told is not meant for children. For children, Rasa Shuddhi is the most important thing, which causes Ahara, Sarpedi, Varthedi, Tharedi, Yapedi. That's all.
So, sir, as you told that Rasayan was not for children. So, जो च्यवनप्राशन आजकल दिया जा रहा है बच्चों को, that is also wrong then.
Everything is wrong because for development of thadus, what is required? Food is required, not medicine, right?
Right. Yeah.
And rasayanas are to be done in Purve Vaisi Madhyeva, and Chavanaprasha is indicated as it is not like other rasayanas. It is not Vata Seva along with rasayanas. It has to be done. It is Chavanaprasha is an asana itself. It's a meal itself. So patient will be taking Chavanaprasha at a meal time, and when it gets digested, the next food will be along with milk or that whatever is prescribed, that will be taken. But nowadays, what is being followed is at bedtime, will be given Chavanaprasha along with milk. So they are not following the rules of Rasayana. Plus, and it is not the age. This Rasayanas, medications are indicated to prevent further decay or to prevent once the dhadus are mature only you can take rasayanas. In children, they are asampurna dhadu. Dhadus are not properly developed, they are not mature. And for dhadu sthiratva and to prevent or to delay the maturity process, rasayanas are taken. So it is wrongly taken as well as wrongly consumed also. It will be causing more problems in children rather than rasayana effect.
Sir,
Rasayana, no. Ghrida janayadi balagni medha. Kashyapa told no. Gridam janayandi balagni medha. Balagni and medha is improved by Ghrida, go Ghrida. Even that is Rasayana. In right stage when Ghrida is being habituated for the child, that will serve the purpose of Rasayana.
yeah. Sir, about that vaccine and drug injury to immune system in kids, what's your stand on that? It should
For Ayurvedic
be taught
students,
in.
for Ayurvedic students, when they are learning about vaccines, they have nothing to do with that, right?
Yeah.
So, what sort of practice they have to adopt to improve their immunity? Plus, what sort of dysfunctions develop with these vaccines? That are to be taught. Not like vaccine should be taken from day of birth and after 10 days, after 1 year, these vaccines are to be taken by to learn by BAMS students. They are just that's just for general knowledge. So what they need to know is what all injuries can develop or what all adverse effects can develop or how health is affected by these vaccines and how far they are effective and how to prevent such things are to be taught in Ayurvedic immunology. So vaccine injuries plus vaccine adverse effects are to be taught for Ayurvedic students, not like when to take vaccine.
So regarding
Thank you.
the adverse effects of vaccine studies, it can be done as vaccine fundamentally what are the problems of vaccine, fundamental logic of administration of vaccine. As sir told directly, vaccines are bypassing the innate immune system and directly passive immunization. So what happens is innate immune system is getting crazy. So it doesn't know how to respond when a microbe comes, how to respond. So it can cause major problems. And second, how it is affecting immune system, altering the immune system. different kinds of vaccines. Some are affecting Vatashaya, some are affecting Pittashaya. Vatashaya Gadam Visham. Now we know that polio is eradicated, but Guillain-Barré syndrome is emerging. Lots and lots of cases of Guillain-Barré syndrome and other neurological disorders are emerging after infection. So Pittashaya Gadam Visham, SLE, all these are very much high nowadays. Behcet disease, SLE, all these Arum Shiga, Rekta Dushtija, Sama, Pitta, Rekta Dushtija rogas are there by Ojo Vyabat. Allergies are very common today. So, and apart from that is the fundamental biological property of fundamental biological harm of the vaccine. Second, vaccine ingredients, they are to be analyzed. What kind of ingredients? Nowadays, cocktail vaccines are given to children. There are contradictions among pediatricians even. Some pediatricians are telling it's very dangerous to mix various vaccines. If a vaccine is not given to a child, before many things are mixed together and given at one point, it is causing so much of adverse effects in children. And we know many behavioral disorders like ASD. So it is a duty of Ayurveda physician to explore this by research. This is what one important aspect is in immunology research in Ayurveda. It's not like effect of Suvarna Prashana in children. This should be the point of research in PG, Kaumarabhritya, PhD, etc. What vaccines are doing, the mode of working of vaccines in immune system. Yeah.
Thank you, ma'am. Thank you, sir. Next question, Archana.
Ma'am, our next question is primary health care of Ayurveda is missing in Comar-Bhritya department and all sorts of acute infections like fever, cough, vomiting and other infections. Common metabolic and hormonal error in children, pediatric disorders like hypersensitivity, jaundice in neonates and child, sick child estimation of alert sign, and medical emergencies handling by Ayurveda management. What's your stand on this?
Yeah, actually, I have made a small format regarding primary healthcare, how the curriculum should be in Ayurveda. I have prepared a brief format. I did it in a few hours, so I don't think it is perfect. But still, the basic adoption, I'll just read out. Evaluation of a sick child is to be taught. Evaluation of a sick child. Because ultimately, Ayurveda Kaumarabhritya expert is meant to treat the sick child, right? So evaluation of sick child can be done in 3 ways. Patients who can be managed with close outpatient follow-up can be managed in close outpatient OP follow-up, who needs to be admitted and who needs urgent technological or surgical care stabilization. These 3 classes. So 1 and 2 can be managed by Ayurveda Kaumarabhritya or primary BAMS physician also, 1 and 2. So I'm coming to the points, history taking. These are all done in a specific way, like symptom reviews are done, head, eye, ear, nose, throat, everything. First, before that, you have to check for respiratory distress, shock, or altered consciousness. All these are fatal things which are to be considered. Followed by that, persistence of abnormal vital signs. Nowadays, I don't think it is taught in Kaumarabhritya OPD, like persistence, tachycardia is there. It can point out to several causes in children like myocarditis. Tachypnea is a sure sign of pneumonia. But how many Kaumarabhritya students are taught that and shown a patient with pneumonia with tachypnea? And irritability can point out to encephalitis. Just some example I have taught. I have included. And febrile children, principles of first aid management in fever without any medication, non-medicational first aid management of fever in children. That should be taught, very important. Then coming to differentiation of allergy and infection in children, very important. These are all applied things. How to differentiate when a child comes with bronchial asthma or cough. How instead of prescribing Dashmula Kadutraya and Vasharishta Kanagasava, physician must be scientific. He should be able to know the differentiating causes. It can be by foreign body, rarely, but more common causes are allergy and asthma. Allergy and infection. So Ayurvedic principles of diagnosis, differential diagnosis between allergy and infection is to be taught, and management. That is done in SBEBA already. Then differentiating different skin lesions like enanthemas, what is observed in head, foot and mouth disease. from exudates in tonsils. We know that on tonsils we find exudates. So how to differentiate enanthems from exudates, enanthemas from exudates. All these things are practical oriented knowledge. Then lymph node oriented pathologies. Sometimes children come with lymph nodes, external and internal. So what are the different Ayurvedic rational principles for assessment and comprehension of nature of pathologies? Because Acharya advocates to learn Vigara, Tasmat Vigara, three things. Tasmat Vigara Pragriti Adhisthana Antaranicha Samuthana Visheshamsha Buddhva Karma Majari. So we are learning to become practitioners, not shloka chanting Panditjis. So everything practical aspects, Vigara Pragriti, how to understand. Adhisthana, Samuthana Vishesha. Then next is hormonal dysfunction. Sometimes obese children, thyroid dysfunction, constipation. Suppose a child comes, chronic constipation. We must know the causes. It can be rarely by hypothyroid. It can be by less drinking water also. So we should be able to, instead of prescribing Tribala Churna or Grida or Erenda Daila, we should be knowing what is happening in the child. For that, specific and specialized training is required. Then differentiating rails, ronchi and bees in children. I don't think it is taught in Kaumara OPDs how to differentiate auscultatory sounds. Then abdomen, normal and abnormal appearance of abdomen, abdominal wall in children. And if there is no movement in abdomen, it can be by peritonitis, or sometimes it can be by large amount of fluid or gas in the abdomen. All these are important. Then skin ailments, Kushta Chikitsa is prescribed. Karappan, in Malayalam, it is that Arogya Raksha Kalpadruma, several yogas are mentioned in skin diseases. They are directly prescribed in Kerala without assessing anything. Instead of that, one skin condition comes, you must be learning to differentiate whether it is by infection, whether it is primary skin disease or secondary, by an infection or allergy, autoimmune, metabolic or complication or drug allergy, fungal, whatever it is, we must analyze by Ayurvedic diagnostic principle and render treatment. Then Ayurvedic diagnostic principles, treatment principles, choice of medicine rational. Medicine rational. So diagnostic principle should be taught, treatment principle should be taught. All these are practical, not theory. Then COMR, choice of medicine rational. How this medicine is chosen in this condition, that students should be made to write why this medicine, why this diagnostic principle, why this treatment principle. Choice of medicine rational means rational behind the choice of medicine, right? That is done by in SBBA. You know how a medicine is chosen. Three karmas: Deshja karma, DK, and RK. So these are to be explored in the patient, and it has to be. Then understanding infections based on different aspects. Vigara, Prakriti, Adhisthana, Samutana, Vishesha. I have seen in your syllabus measles, chickenpox, everything. But these are to be done with regard to, not the least, danger signs that is mentioned in Ayurveda also. Arogya Raksha Kalpadruma, Akshnor Nimilinam Sashwat, Stana Dvesha, Aradikrama, and there some points are mentioned in Arogya Raksha Kalpadruma, right? Akshnor Nimilinam, always keeping eyes closed, Stana Dvesha. So the same things are mentioned in modern pediatrics also, unable to breastfeed, drink or eat, vomiting, convulsion. Same thing is mentioned in Ayurveda, but nobody is teaching all this. Then scientific documentation of clinical case studies in Kaumara. How to scientific document clinical case study in Kaumara. All these aspects, practical oriented knowledge is required.
Ma'am,
So,
your
tell me
voice
something.
is breaking. Sorry,
Is it
ma'am. Ma'am, ma'am,
not
your voice
hearing?
is breaking, ma'am. Yeah, ma'am.
Now is it here? Hello?
Is it clear
Hello?
to everyone? Please reply on chat. Archana, is it clear to you?
Breaking. Ma'am's voice is breaking.
Now is it clear?
Yes,
Yes,
ma'am.
ma'am.
Okay, okay. I will come closer and talk. That much only.
Yeah.
I don't know how far you are able to hear. The last point was danger sign, fatality, signs of fatality. explained in Arogya Raksha Kalpadruma as well as Kashyapa Samhita as well as modern pediatrics. Both are, everything is same only, but that has to be taught. And first, what I told is most important. Patients who can be managed with close OP follow-up, patients who are to be admitted, differentiating both the cases. So all these guidelines, this I prepared in less than half an hour. It is not complete. It has got imperfections, but these are all to be taught in primary healthcare in children in Ayurveda.
I would like to add that already what Sangeeta told, Sayeva dosha, Ushyasan, Dvaradya, Vyatyasya, Matrattvasya Kaniyasi. Everything else is same. But in Kaumara Pratya OPD, what usually seen is acute cases won't come because children having fever, children having diarrhea, children having respiratory distress, they will be directly going for allopathic management because it, as it is a child, as it's a tender body, and Kaumara Pratya experts are not confident enough to treat such acute conditions. So usually in Kaumara Pratya OPDs, usually acute cases won't come. So whatever we are doing in Kaya Chikitsa, we are learning in Kaya Chikitsa. In Kaya Chikitsa itself, it's not properly deciphered in modern sense, like infections, how to identify infections in Ayurvedic science, how to understand allergic manifestations in Ayurvedic science. Such differentiation and comprehension is not happening in Ayurvedic science. So both in Kaya Chikitsa as well as in Kaumara Pratya, acute cases are not coming. So we are learning Kaumara Pratya as a separate subject to get specialized knowledge and expertise, practical knowledge in that specific field. So as we are not getting, as in Kaumara Pratya OPD, such cases are not coming, students are lacking that knowledge. They are not learning how to manage acute infections as well as allergic conditions, acute manifestations, and the proper way of managing that, how to comprehend in Ayurvedic science and how to manage that. So that is not learned. That's a big defect. So whatever it is, we have to learn and understand what exactly the disease and cause of the disease, and in children how to apply. That's not happening in colleges. That's why we are lacking in such fields, or we are not getting cases of acute fever or diarrhea or respiratory problems.
सर आजकल जो है कि हमारे उसमें कि संस्कृत नाम दे दिया जाता है कोई भी मॉडर्न डिजीज को एंड फॉर एग्जांपल एक बाल ग्रह के जितने भी हैं उसे एक्यूट इन्फेक्शन और वेरियस काइंड ऑफ डिसऑर्डर से कोरिलेट किया जा रहा है इज इट राइट और व्हाट्स योर स्टैंड ऑन दैट एम आई ऑडिबल
Yeah.
या
Actually, Shastra is set of, it's not set of verses or set of sutras or set of siddhantas. It is knowledge. So what knowledge you are gaining is Shastra. And its application is more important, or objective is more important, or what you need to understand in practically or clinically is more important. So Shastrarthas or Upadeshas. Upadeshas are how to do and not what to do. So we need to develop intelligence. Smritiman, Hedu, Yuktitno, Jidatma, Pratipattiman, etc. are needed. For that, if you just name it in Sanskrit, so Romandiga, Masuriga, you will not get any sort of information from that. Not only information, you are like a blind person.
नॉट ऑडिबल
All rubbish, because it's not serving any sort of purpose. So always a disease is to be identified with Nidana Panchaga and how to correlate. So such things are not happening, and just giving a name and learning what all are mentioned in the Western science is of no use. Yeah.
Yeah. Actually, your voice cut in between, sir. I
Actually, naming
yes.
audible
Yeah.
Yes, sir.
just by giving a name is not going to serve any purpose. That's what I meant. Always a disease is to be comprehended with Nidana Panchaga. That is the brief what I explained.
Yeah. Okay. Thank you, sir. Thank you, ma'am. My next question is, and should there be Ayurvedic pediatric rational therapy principle should be taught, which covers childhood trauma, principle of choosing scientific nutrition in children, demonstration of Ayurvedic growth parameter.
Yeah, it's
Like,
a
yeah,
yeah, it's a very vast topic. Principles of rational therapy in children is to be included in the syllabus. Principles of rational therapy, Ayurvedic treatment and Ayurvedic prescription for children, how to make it proper. That is to be taught in Ayurvedic OPDs, teaching OPDs. So there are many points when I just checked all the Samhitas. There are so many points. What is the objective of treatment? Kashyapa told, Avyahata Sharirayur Abhivardeda Vakadam. Ityartham Veshajam Proktam Vigaranam Cha Shandaye. Avyahata Sharirayur Abhivardeda Vakadam. For uninterrupted growth and nourishment and upachaya of Sharira. Bheshaja is meant for. And for reversal of disease. And there are so many principles. Alpapeyam, Mahaviryam, Prenanam, Belarakshanam, Vyabhatav, Alpadosham cha, Mandaglapanam evacha. So all these samskara guna sambannam, that should be the nature of Beshaja given to children. Nature of Beshaja should be Alpapeyam, Mahaviryam. Small dose itself, it should be optimal Virya, Viryavat Aushadam, no? And Prenanam, Belarakshanam, Acharya is focusing on Belarakshanam. And he also says in another context, Yenna Adura Belam Handi, Vyadhi Viryam Nigandijam. So Vyadhi Virya is reduced and Adura Bela is retained. And another important principle, Vyadhi Dosha Belagnibhyo Hinam Tebhyo Adhigam Chayach Ajitnyasida Purvam Cha Gunesh Shokte Yogasatmyam Duryuktam Anishtam Anasastaya Yasya Pidasya Pagande Dosha Sukshmobalakshide. All these kind of medicines are to be avoided. You know, Vyadi Dosha Belagnibhyo Hinam Tebhyo Adhigam Chayat Ajitnyasida Purvam Cha, that which is not researched, which is not heard about, unknown compounds, what is being introduced into children for the first time. Ajitnyasida Purvam Cha Gunesh Shokte Vivarjidam Aroga Satmyam Duryuktam Anishtam Manasascha Yasya Pidasya Pagande Dosha Sukshmobalakshade. Even minimal dosha is left in the body after administration. Such medicine should not be used. And also, again, it is mentioned common principle. Vaishajya manavasthayam pathyam abhi avajaridam gunam na kinjit kurude doshaya evito kalpade. So, need of pathya. And also, again, there are so many भिन्नेषु अपि विकारेषु हेतुमेव अवलोके तस्य तस्य श्रमं कुर्यात् न तु व्याधि प्रशमनम. So always it is like tadeva dosha dushyasya juradya vyadesya भिन्नेषु अपि विकारेषु, any kind of disease in children हेतुमेव अवलोके, you have to consider hetu only. तस्य तस्य श्रमं कुर्यात् न तु व्याधि विपर्ययम्. That is another principle. Then viruddha upakrama vyadher sahajaryena sambhava. By viruddha upakrama, nowadays it is happening. Many types of treatments are given to children aimlessly. So viruddha upakramatvat vyadher, vyadhis can generate. Sahajaryena sambhave jvarasya prashamam kuryat sahajarya avirodhija. Then yasmat rogavadisyoyam tasmat pradhanyam arhati. So when you are treating a child with many diseases, You have to consider infection with most importance. Jara. Why? Because yasmad rogavadi soyam. Tasmat pradhanyam arhati. It is the main disease. Infection, if not subsided, it can cause fatality. Then again, vyadhayo yadi tasya syat pakshat purvam. How to administer medicine in infants. If jwara is happening or any adhisara is happening to children before 15 days, purvida kshira vrittitvat tasya madhu chikitsikam. You have to treat mothers only. That's what SBB is doing. No, till 6 months, 1 year, we are not treating infants. We are treating mothers. So this is what is approved in our science also, Arogya Raksha Kalpadruma. And see the subtlemost aspects. Abhachyamanam bhaishajyam bhuya jwalayadi jwaram. Acharya Kashyapa has mentioned when to give medicine in jwara and when not to give medicine. If you are giving medicine in abhachyamana dosha status, abhachyamanam bhaishajyam bhuyo jwalayadi jwaram. It can increase jwara. It can increase the pathology, samprapti of jwara. So there are so many principles. I am just quoting a little bit only. Balina stira dehasya tasya samshodhanam vishak. Every child panchakarma is being done nowadays. But panchakarma to be done strictly intended conditions. Balina means those who are having bala, and stira dehasya. Stira deha in dhadus are asampurna in children, not stira deha. So only in those people there is consideration and prabodha utklishta dosha. Then only shodhana karma is intended. So where to do shodhana, where to do shamana, these are only just 25% of the entire things explained in the science. Not even 25%, just some examples. So definitely there should be a topic on rational prescribing in children, and also it should be taught in the training OPDs. Principle wise training should be done in OPDs. That's
As Dr. Ramya told, all these are, we are to gain specialized knowledge. So when it was taught in third year, we don't have the basic knowledge of Kaya Chikitsa or how to apply in patients. So before learning the basic principles of treatment or in Kaya Chikitsa, they are learning Kaumara Pritya. So they won't be able to understand what principle is to be applied in which patient, in which status. So as they haven't learned Kaya Chikitsa. So the basic mistake was Kaumara Pritya was kept in third year and final year Kaya Chikitsa is being taught. So only the dose is different. Remaining everything you have to learn from Kaya Chikitsa, principles of Jwara or Kasa and other things that has to be taught first, and later they need to go for specialization in Kaumara Pritya. But it's not happening, and the reverse was being done till now. Next year syllabus is going to change again. And more important thing is all these are to be practically taught. So many principles which are very much important or very much significant in children are to be taught practically also. Both these are not happening. After teaching Kaya Chikitsa, Kaumara Pritya is to be taught. And the second thing, all these principles are to be taught practically also. Both these things are not happening. That is the most important and most crucial lacuna in the curriculum as well as training for students.
I second that strongly.
I agree.
Without practical knowledge, no use of learning any subject. Ayurveda is applied science, not theoretical science.
Completely agree. Thank you, sir. Thank you, ma'am. Next question, Arsa.
Our next question was about Panchkarma only, ma'am. So our next question is impact of Panchkarma on children. Is congenital disease are curable by doing Panchkarma on children?
Some interruption is happening.
Ma'am,
I
not.
couldn't hear.
Ma'am, your voice is not audible.
No,
Problem or
We
Yeah.
couldn't hear.
Impact
Last
in, yeah.
impact of Panchkarma on children, or is congenital disease are curable by doing Panchkarma on children? Congenital diseases.
If congenital
Yeah.
diseases are curable by doing panchkarma on children. Yeah.
I think Rajkumar sir is speaking.
Voice is breaking, sir.
Is it? Achin's voice is breaking. Am I audible? Am I audible?
Yes, ma'am.
Yes. Yes,
Yes,
ma'am.
ma'am.
I have not much to speak on that, but yeah. Is it audible?
Not clear, sir. Sir's voice is breaking.
Ma'am, you should off your camera.
Congenital. Let me start. Am I audible?
Yes,
Yes,
sir.
sir.
Congenital is the diseases which are developing at the time of birth. So, Shukrasra Garphini Pojya Cheshta Garphasya Rudushu Esya Dosho Atiga, that which develops the dosha which is increased at the time of birth is termed as Prakriti. Prakriti is Swabhava. So that which develops at the time of birth becomes, if a structural damage or functional damage is there, dysfunction is there, it becomes part of his Prakriti. Prakriti is Swabhava.
Sir, voice breaking.
As children are contraindicated for Panchakarma, and Panchakarma is Shodhana of doshas. It is not applicable in Swabhavika Rogas, or which develops at the time of birth, or which develops along with the Prakriti. It cannot be managed. So, Nishpradikriya is mentioned that Swabhava cannot be treated. That which develops at the time of
Sir,
yeah,
uh,
not audible.
no, no, sir. Voice is
There is some
breaking, sir.
problem with that.
Yeah.
We will, I think we can continue the next session. I don't know, both of us are not getting properly.
I think we can continue in the next class because next,
Yes, ma'am.
yeah.
Yeah, in next episode we can do.
I am shouting here. You are telling that it's not audible.
As you have off your camera, your voice is a bit audible.
Oh, okay.
No, it's
So,
audible.
Yeah.
The 3 points I would like to clarify is congenital diseases, Panchakarma, and whether it's curable with Panchakarma. So, congenital diseases are diseases that develop at the time of birth. It's like Prakriti, either structural dysfunction, or structural uh, uh, affliction, or functional dysfunction. So, whatever be it, if it is developing at the time of birth, it is Prakriti. Prakriti is Swabhava. Swabhava Nishpradikriya. It cannot be treated. So, first thing, congenital diseases, if it is developing at the time of birth, it cannot be treated. If it is an injury or something, it can be managed. Otherwise, it cannot be treated. Second thing, Panchakarma is dosha shodhana. So, whenever there is increased dosha, but in this condition, it is Prakriti itself or part of Swabhava itself. So there is no increased dosha to remove it. To be removed, there are no doshas. So Panchakarma Chikitsa or Shodhana Chikitsa is not applicable for congenital diseases. Plus, children are not indicated for Panchakarma, Shodhana Chikitsa. So with these 3 points, I would like to clarify.
But the thing is that like in today's like autism, ADHD, so many Panchkarma package are suggested to children. So this is wrong according to as you told so now.
Yeah, it's totally wrong.
Voice what? अच्छा आवाज आ रही है?
नहीं नहीं not audible.
अन्ना
Sir, it's not audible, sir. The question, it was actually last question only. One question was second last question. It was. We will discuss this question in the next episode. In episode 11, we will discuss. As only two questions were left, so we will discuss due to network issue. I guess there are so many audio problem is there. So we will discuss in this next episode, sir. My audio is audible to everyone.
Yes.
yeah
Yeah.
you are audible.
Yeah. So one announcement I wanna make on this episode is like in 19th and 20 in Mangalore, pediatric this seminar is going to happen, organized by Dr. Hari Krishnan Bhatt sir. So those who are interested to learn SPBA, they can attend this CME in Mangalore and they can contact, and the details are available in SBBA Wisdom series. They can contact Dr. Hari Krishnan Bhatt sir for more information. So all the pediatric disorder has is going to be covered in this seminar on 19th and 20, which is going to happen in Mangalore. So this was the announcement, as because today episode is was exclusive to pediatric, so I thought to tell this announcement here. So, sir, we will discuss the last two questions in next episode. In episode 11, we will discuss this
Yeah.
along with our next subject. Yeah.
Okay.
Okay. Thank you so much for your valuable inputs. Although the network was not great for me, also for you also. But anyhow, we managed 1 hour.
Okay.
Thank
Yeah, no
Anyway, it
problem.
thank you
happens.
so
It's
much.
not
We'll
in
make
our
it
hands.
Yeah.
session, hopefully. Thank you to both of
Thank you.
you.
Thank you, sir. Thank you. Thank you, ma'am.
Thank you. Namaste, sir. Namaste,
Thank
ma'am.
you, sir. Namaste, ma'am.